I'm going to take you now live to North Broward Medical Center. This is a press conference that's just getting underway right now. They're getting ready to give us an update on the patients that were transported there. Let's listen in.
Yeah, doctors are here.
If you would step up and say your name and your title and spell it before you go, we would really appreciate it.
Good evening, Evan Boyer, Evan Boyar, MD, Chair and Medical Director for the Department of Emergency Medicine at Broward Health North.
Igor Nichiporenko, IGOR-NICHIPORENKO, Medical Doctor. I'm a Trauma Medical Director for Broward Health North.
Okay, can you talk to us about what you guys have been seeing?
So, first and foremost, we want to extend our condolences and sympathy for all those people, family members involved in the tragedy today. Through a Broward Health system, we received 17 patients. At Broward Health North, we received 8 patients and 1 suspect. The suspect was treated and released in police custody. Of our 8 patients, we had 2 mortalities, 3 in critical condition, and 3 are stable.
What condition was the suspect in?
I cannot disclose that.
Can you repeat again? I'm sorry, I think the first sentence you said 17 patients at Broward Health North, but I don't believe that's correct.
No. System-wide in Broward Health, there was a total of 17 patients.
System-wide.
9 here, 7 Broward General, and 1 at Coral Springs.
Can you talk about what type of injuries you're seeing? How serious are these?
Of the 8 patients that we had, not including the suspect, 2 mortalities, 3 in critical condition, 3 stable.
But what are you seeing? What kind of wounds?
Out of respect for the family members, out of respect for our patients, we're not going to disclose that information.
Are these all gunshot victims?
Yes, they are. They're all gunshot victims.
Okay. So sometimes we see people that are trampled on their way out or sustain other sorts of injuries, so that's why we wanted to clarify that. So all the 8 victims here, those were all gunshot wounds, correct? Some sort of gunshot wound.
That is correct.
Can you elaborate on the ages of the patients that were brought here?
Again, we can't talk about the age or any information related to the patients, out of respect to the families.
Can you talk about, were you guys, I know you guys were in lockdown, was this can you describe for us, is this a mass casualty incident? What was it like inside as these patients were coming here after the shooting?
Sure. So, now, fire rescue on scene in conjunction with Broward Sheriff, pre-hospital. Routinely run drills at our institution to be ready for instances like this. So we have a process in place that gets initiated, so there's calm, collected care that our patients receive.
Can you tell us anything about the fatalities, at least their ages? Do you believe they're students, possibly people that are working at the school?
In respect for our patients.
Can you talk about just seeing this sort of thing, knowing that just as human beings, outside of being doctors, treating these people who have come in here after experiencing one of, if not the worst event of their lives, and having the responsibility of treating these people and ensuring the best outcome that they can have. I mean, how does that affect you all just as human beings?
Well, we do this every day. So penetrating trauma, non-penetrating trauma, we're level 2 trauma center, and that's what we do every day. So fortunately for everybody, we were located very close to the high school where this shooting happened. So fortunately for everybody, they brought these patients to our hospital, and we were able to do a great job to do the right thing.
How do you, the suspect was brought here, I know you can't say much about, his medical condition or whatever. But for a lot of people at home, you know, they might be surprised that the suspect was being brought here. How do you guys kick in the Hippocratic Oath and do your job at knowing what this guy potentially is accused of doing?
Every patient that comes in gets treated as a patient, and we take care of them medically, and that's what we do.
Was there any particular reason why he was brought to this facility versus one of your other facilities in the hospital system?
Because of the location. They have to go to the nearest trauma facility, and we were the nearest trauma facility.
Is this the biggest mass casualty you can remember?
For our hospital, yes.
Are you expecting more victims?
We cannot comment on that.
Are any victims?
Can you tell us if it was large caliber, small caliber? I mean,
No,
can you
we
elaborate?
cannot comment on that.
Do you know the update on conditions for what the other hospitals, the patients at the other hospitals?
Not right now.
Of the 6 patients that are still here, will any of them be released tonight?
No.
Are any of
They-
them still in surgery? Did the surgeries go on after the incident?
We still have 3 patients in the operating rooms right now, and
Did all of them
they're in
undergo-
stable condition.
Did all of them undergo some kind of surgery?
No.
Can you describe what those who are, I guess, were not as serious injuries, what their demeanor was like? Can you, I mean, I know it's obvious, but if you can describe it for us?
Well, I mean, I prefer not to comment on a specific patient's demeanor, but, you know, as a human being, you could imagine that they would, you know, be emotional about the whole situation.
Can you describe, you got a call at mass casualty coming in?
Pardon me?
You got a call mass casualty coming in? Is that how?
We work
Yes.
closely with our pre-hospital personnel
So
and
you guys
set that up.
jump into?
Yep.
How many
Can you walk through what's next for these patients, specifically the 3 in critical, 3 and stable, and their families, in terms of services? I understand chaplains are now here.
They're going to have successful surgeries, they're going to recover, and they're going to go home.
How many doctors are working on this?
Thanks very much. Have a good
Thank
night.
you.